Hello, this is Dr. Joe DeStefano, Medical Director for Urgent Care 24/7. Life is 24/7 and so are we. We are going to chat today about hyperthyroidism. The thyroid is the gland that sits in your neck in front of your trachea. It makes thyroid hormone, which is the hormone that pretty much controls your metabolism. In hyperthyroidism, your gland kind of runs amok and makes way too much thyroid hormone. There's two main diseases that do this. One is Graves' disease. Graves' disease is an autoimmune disease. The body starts making an antibody against the thyroid, but the antibody is called a long-acting thyroid stimulating antibody, a LATS. And it hits the TSH receptor in the thyroid gland and tells the thyroid to start making thyroid hormone. And there is no negative feedback loop on it because this is the immune system doing this to the thyroid, not the master gland in the head. People with severe Graves' disease, a normal T4 level would be, say, 1.8. These people can have free T4 levels of 6, 7, 8, 9. It causes high output heart failure. People start to get short of breath. They start to have abnormal heart rhythms called atrial fibrillation, supraventricular tachycardia, where the heart just beats too fast because it's getting all of this thyroid hormone stimulating it. People don't process their fluids correctly, and they'll actually start to swell just like they were hypothyroid. And kind of imagine that somebody was put on a treadmill and made to run 4 miles an hour in that treadmill 24 hours a day, 7 days a week without a break. That is what hyperthyroidism does to people. It puts them on the treadmill. At first, people might like it. They can eat whatever they want and they keep losing weight and just burning all the fat off their body. But eventually, it starts to break down. And a lot of times these patients will come in and they have had what's basically a circulatory collapse from just all of this overstimulation of their body by all this excess thyroid hormone. Another thing that will cause hyperthyroidism is something we call toxic nodular goiter, TNG. And in that, a section of the thyroid forms nodules. And these nodules just make thyroid hormone no matter what. They are independent of TSH from the master gland. That type of hyperthyroidism sometimes is a little bit easier to manage, but it can create all the same scenario that Graves' disease can. One way you can kind of tell the difference is that in Graves' disease, the whole gland is swollen. In toxic nodular goiter, those nodules swell, but the rest of the gland doesn't. So the gland in a toxic nodular goiter is big, but it's lumpy. You can treat either condition with antithyroid drugs, such as Tapazole or PTU. Which one we use depends on whether or not the patient's pregnant, other issues like that. Or you can use radioactive iodine and kill back the gland. Radioactive iodine works really good in toxic nodular goiter because the rest of the gland is asleep. It takes up no iodine, and the radioactive iodine goes right to the overactive nodules, and they're killed. So for toxic nodular goiter, radioactive iodine can be very precise in treating the condition. Graves gets more complicated. There can be a Graves' eyes disease where the antibodies not only hit the thyroid, but the antibodies hit the muscles around the eye, and people get these big bug eyes and frog eyes, and they get double vision. And a lot of time the double vision is one image above the other instead of one image side by side. That eye disease is often independent of the thyroid disease. Both can be treated with radiation. Some people are not candidates for radiation surgery for various reasons, um, and sometimes they're too sick, and you can't suppress them enough, long enough to make it safe to give them radioactive iodine, because radioactive iodine will actually temporarily spike the hormone levels. That is where there still is a role for endocrine surgeons and thyroidectomy, where they take part of the gland out and leave enough gland so that the thyroid hormones are level, are normal. But there's different approaches to that. But that is it. Hyperthyroidism is characterized by a very low TSH with a very high free T4 and free T3. Two types of causes: Graves' disease, which is the autoimmune; toxic nodular goiter, which is just a genetic mutation that causes you to make these hyperfunctioning nodules in your thyroid. And of course, the other type of hyperthyroidism is what we call iatrogenic, where people will get thyroid hormone to try to lose weight or do other things, and they just give themselves too much thyroid hormone. That is iatrogenic hypothyroidism. The long-term consequences of doing that or other low-grade, I do not like the term subclinical hyperthyroidism, because it really is no such thing. Because if you have low-grade hyperthyroidism long enough, you're going to have bad effects. One of the things you will get is weakening of the bones, osteoporosis. Again, this is a kind of very complicated disease process. Cannot be worked out of a cookbook. Again, the provider taking care of you, NP, PA, MD, needs to do history, physical exam. In hyperthyroid patients, we look to make sure that the reflexes are not abnormally brisk. And they have, and you often have to look at a full thyroid panel in them as well. But generally, that is not as important as it is in hypothyroidism, because in hyperthyroidism, you really do just have to make sure that the TSH is detectable, that you have a TSH level that isn't 0.001. But again, a lot of times you'll throw in a T4 in monitoring as well, because if your T4, if your TSH is suppressed, but your T4 and T3 levels are still in normal range, and you're not symptomatic, you're probably all right. A lot of times, with the exception of toxic nodular goiter or successful radioactive ablation or thyroid surgery, this is a chronic condition and has to be managed over time, and you have to be monitored for the side effects of the anti-thyroid medications. This is Joseph DeStefano. Thank you for joining me on this chat of hyperthyroidism. Urgent care 24/7. Life is 24/7, and so are we.